Welcome to our live demonstration of the HCG pregnancy test, a pivotal tool for early pregnancy detection. As we unbox the test kit, you'll notice the sterile packaging, reflecting the importance of maintaining sanitary conditions for accurate results. Each kit generally includes a test strip, a dropper for urine collection, and detailed instructions to guide you through the process seamlessly. To begin, we will gather our supplies and our sample. For an accurate reading, it is best to use the first morning urine, which is concentrated with human chorionic gonadotropin, HCG, hormone, a key marker for pregnancy. In our demonstration, we will carefully fill the dropper with the sample, ensuring we follow the recommended guidelines provided in the instruction manual. Next, let's proceed to the test strip. By holding the strip horizontally, we will apply a few drops of urine into the sample well. This crucial moment marks the start of our observation. The HCG hormone in the urine will climb up the strip, encountering reactive agents that will indicate the presence of HCG by displaying color changes. As we wait for the results, typically 3 to 5 minutes, it's significant to maintain an optimistic atmosphere, as this period can carry emotional weight for many. During this time, let's discuss what various results could indicate. One line may suggest a negative result, while two vibrant lines often confirm a positive pregnancy. However, it's essential to follow up with a healthcare provider for further testing and confirmation. As the timer nears its conclusion, excitement fills the air. The test strip is revealing its secrets. Now, we observe the results together. If two clear lines appear, we acknowledge the hopeful news. If there's only one, we reflect on the possibility of retesting or the need for additional time before making any conclusions. We conclude our demonstration by emphasizing the importance of understanding how to use the HCG test effectively. It remains an essential first step in the journey towards motherhood, paving the way for joy and anticipation, coupled with the necessary medical support and guidance.